Now you are live. Okay. Well, Professor Kuso, I think we are done. You can start now.
Okay, thank you.
Okay.
And good afternoon, everyone. Today is my concluding talk, and the topic is functional MRI applications to cognitive neuroscience. And we now are quite aware about the different techniques which are being used in studying cognition and other behavioral disorders using functional MRI. Today, we will have a little different talk, which will be mostly based on the applications. And we will have a brief outline will be introduction to stress and cognition, then cognitive assessment and interventions, then applications in anxiety, in depression, in alcohol use disorders, and some useful methods to improve your cognitive functioning by meditation. So there are some of the topics which we will discuss today. And before we start anything, we must have idea what do we mean by stress. Everybody seems to be talking about stress nowadays. And what do mean by stress? That stress is anything that poses a challenge or a threat to our well-being is called stress. So, and this definition of stress is different for different generations, and changes with your age. So, for a student, for him, the stress is to get the top scores, and for a professional, it is to how to ride the ladder, to fast and about your A bars and promotions. And after you go to middle age, then you are stressed about having good living and earning more money to have a good lifestyle. And then sometimes some people don't have any stress, but they thinking about stress gives them stress. So it's something very, and all these stressors, if it's very trivial, I think they're all avoidable, but we still get stress about these things. But if you look at military scenario, this is where people are the soldiers who are in extreme isolation places. They are in difficult terrains. They are in extreme geolocations, and they are facing every day. They are facing trauma. They are exposed to chemical and toxic gases, and at times they can also get exposed to radiation exposure. So these are stresses where a Jawan is exposed to, and it can really cause. These are the actual stresses through which the person can have will have difficulty in performing to their optimal levels. So it is very important to find methods so that a Jawan or anybody else can increase his coping stress strategies to improve their cognitive function. So what happens in stress? Stress is a series of events that begin with a stimulus called stressor, which precipitates a reaction in the brain and subsequently activates physiological response and affects cognitive performance. When you're stressed, you start having sweating, there's a blurring in your voice, then you feel weak. This is all when you're too much stressed. And one has to cope up, with the stress. You have to have your own strategies to cope up with the stress. And if you look at these two graphs on the right hand side, it shows how when the stress increases, how the performance also increases. Stress is not always bad. We always say the optimum stress, if you get, it will give you can perform much better than when you are in without any stress. So when the stress is low, you are in low pressure region. Then it's a boredom. Then you are just sitting and not doing anything. You feel bored, and then as and when stress improves, the performance also goes up. And then after some optimum stress, slowly the performance will start going down, and there will be a high anxiety, stress, and then unhappiness, and then could be actually a mental breakdown if this continues for a long time. So these stress management techniques allow you to shift your optimal level of stress to further on the right hand side. You can see by different interventions, which could be anything which makes you less stressed. And you can see here also at this point of the optimal stress, you start feeling fatigue, and then your performance, actual performance goes down immediately, with exhaustion and ill health, and maybe the mental breakdown. So one thing is sure, if you have little bit of stress, positive stress, your performance will improve with stress. And beyond that level of your threshold, your performance can go down unless you have stress management techniques which can increase your optimal level or these threshold levels. And definitely you must be seeing around people around you. Some people are very much able to cope up with the stress. Some are not. So you have to adopt some methods through which you can cope up with stress. Now, about the cognition. What is cognition? Cognition is, basically it's the three components. It is the registration of the events, then processing of this event within you, and then retrieval or the output. So it's basically input, processing, and retrieval or the output. Like you have in computer input, then processor, CPU, and the output device. Similarly, here also, you take inputs from the environment and people around you, then you process that information, then you store it for later use, and then whenever you need this information, you do retrieval. So this is all what is three constituents of cognition. And basically in cognition you have sensation, where you accept energy from the environment. Then it's a perception, that is interpretation of that energy. Then attention, and perception is guided by attention. Then memory, you whatever matter you have got it from the environment, you store that in your memory, and this memory helps you in learning, and learning gives you problem solving. And then intelligence, you when you have more knowledge, you are able to solve problems. It gives you intelligence, and you can make better decisions. So this is how the different components of cognition are there. And when you are stressed, too much stress, many of these functions, your attention goes for toss. And then when your attention is not there, you cannot remember. When you can't remember, you can't learn properly. So the whole cognitive processes gets deteriorated when a person is under extreme stress condition. So the cognitive neuroscience deals with this scientific study of biological substrates underlying cognition, with a specific focus on the neural substrates of mental processes. So this imaging techniques can help you in finding out the the cause of these cognitive impairments at cellular level or at the systemic levels. And then then you have you can have metabolic levels, functional levels, and how morphology and function, they are related to each other. All these can be studied using cognitive neuroscience and the imaging. So it is basically a multidisciplinary field where cognitive neuroscientists may have various backgrounds: neuroscience, physiology, cognitive psychology, neurobiology, bioengineering, physics, chemistry, computer science, linguistics, philosophy, and mathematics. I think everybody can contribute to the field of cognitive neuroscience. And the main aim is to have fundamental goal is to identify neural substrates of cognitive processes, and which can be done through structural imaging and functional imaging. Both can be used, and you can relate this structure function relationship through these techniques. So now comes to this enhancement of cognition. So you can have a deficient model or the efficient model. Deficient model means where people have some disease or disorder. So that is a deficient model. Efficient model are the normal people who want to increase their the cognitive performance. So this has two components. One is assessment, one is enhancement. And for enhancement, you all know now how it can be assessed through imaging technique, through EEG and all that. But if you look at the enhancement, how you can improve your cognitive enhancement, and that could be due to some people go for meditation, some people go for music. Music is also a very good stress buster, and it also enhances your cognition. Then video games, very challenging video games, if you play, that will improve your cognitive performance. There are also systems which are based on virtual augmented reality. If you are exposed to those environments, you can also improve your cognitive performance. Then cognitive training and also the medical intervention. Suppose there are some issues, then you can have some interventions through some herbs or memory enhancing herbs, or attention enhancing herbs. One can also try that. So these are the different methods by which, and every individual has one or the other of these, to improve their cognitive performance. They get into these one of these pastime activities so that they can improve their cognitive performance. So now, in today's world, everybody is anxious day and night, and so anxiety is an aversive emotional and motivational state that result in many behavioral and cognitive consequences. It is okay to be anxious when there's some problem, but you will find people around you who are always anxious all the time without any issues. They are anxious. So the anxiety can be a trait anxiety or a state anxiety. So anxiety by state is okay because somebody is ill in the family. You can imagine, person can be under stress, and anxiety levels can be high. But there are people, there's an exam tomorrow, you could be anxious, okay. But there are people who are anxiety by trait. They always have high anxiety, and this will be called as trait anxiety. And the other anxiety, which is, state-wise, event related, that is called state anxiety. So we are talking about here in this study, we'll be talking about the trait anxiety, people who are anxious without any valid reasons. So these are the different type of anxiety disorders, and mostly, many of you may be aware of this. These one is generalized anxiety disorder. The person is continuously, tense, apprehensive, and a state of autonomic nervous system arousal. Then social anxiety, excessive and unreasonable fear of social situations. People are very anxious in meeting large gatherings and meeting people. So that's called social anxiety. Then panic attacks and panic disorders, episode of intense fear that something horrible is about to happen. Nothing has happened, but they have this feeling something horrible is going to happen. Then phobias, then obsessive compulsive disorders, anxiety disorders characterized by unwanted repetitive thoughts, obsessions, and or actions. So, and then there could be anxiety because of post traumatic stress disorder, and also substance induced anxiety disorder. A lot of people get into these drug abuse and all that. Then they also have high levels of anxiety, and there is a direct physiological consequence of that. This anxiety. So trait anxiety, if you look at trait anxiety, effects are seen not only in clinical anxiety, but also within the normal population as a personality dimension. So trait anxiety is basically a personality dimension, and it can be very, deteriorating if a person is having anxiety for a longer duration of time. Because if you don't treat your anxiety well in time, it can get you into a depression. So how we measure the anxiety levels in individuals, that's done by the Spielberger's state trait anxiety inventory. There's a self-declaration form which is given to the individuals. They fill up the forms, and then you calculate the scores, and then you can categorize people in high anxiety and low anxiety groups. So then this is a the DDI study in humans. These were university students who were brought in as volunteers, and we found that there are at least two fibers, fornix and uncinate fasciculus. These are the two fibers in the brain which are responsible for the high anxiety in in humans. So these are the two these two fibers, the fornix and the uncinate fasciculus. These are the two fibers which are shown to be related to anxiety. And then if you see these, the fornix and the fasciculus, these both have, they are showing a direct correlation with the anxiety scores. You can see this is the fornix and this is the left uncinate fasciculus. Both are showing anxiety related, correlation. So these are the two fibers which you can blame if a person is, state has a lot of anxiety. So these are the fibers which are responsible for that anxiety in that person. Then we also did, the spectroscopy on these cases, the MRS in the ACC, anterior cingulate cortex, and hippocampus. These are two areas which are very important in cognitive behavior. So we selected voxels over the anterior cingulate cortex over here, and also in the hippocampus. Then we found these are the spectra from anterior cingulate cortex, and this is from the hippocampus. And then when we did the processing of this spectrum, we found, see, these are the metabolic profiles in these people with high anxiety score. You can see the glutamate levels were much lower in in the in healthy anxiety people compared to the the healthy the high anxiety group. And similar way in inositol, which is supposed to be there present when you have losses in memory, or when there's a some condition where you are like in dementia and Alzheimer's, inositol is always increased. So you see here also in high anxiety group, the inositol is raised compared to the healthy low anxiety group. Similar ways, glutamine and glutamine, you can see the glutamine is also raised in this high anxiety group compared to control. You can see how even your spectroscopy can show the groups which have the changes in the metabolic profiles in high anxiety group and the low anxiety group. You can see how the high anxiety group, the glutamate is high and inositol is also high, and glutamine together, which we call GLX, is also high in high anxiety group. So these are and you can devise your interventions in such a way, then you can repeat these spectroscopy measurements and see whether the people by interventions are coming out of this anxiety syndrome or not. So this is a very these are both these studies are published in very good journals, and we have said glutamate level in anterior cingulate predicts anxiety in healthy humans. This is published in 2014. This was published. Then then we also showed there's a correlation between glutamine levels with the high trait anxiety. You can see these levels are increasing as the trait anxiety is also increasing. So they are showing a positive correlation between GLX and glutamate. The inositol also showed positive correlation, but it was marginal significance. P value was 0.054. So, but glutamate and glutamine together, they showed high correlation with the anxiety score. So that means these glutamate levels in brain are the predictors of trait anxiety in humans. So this is the resting state of MRI in anxiety disorders. You can see these are the resting state networks which were detected: right frontoparietal attention network, left frontoparietal attention network, sensory motor network, auditory network, then medial visual network, lateral visual network, temporoparietal frontal network, default mode network. All these networks were identified in these high and low anxiety groups. And when we did the comparison between the two groups, then we found at least 4 networks where the high anxious people have diminished the connectivity in these networks: the auditory network, the medial visual network, the default mode network, and temporoparietal frontal network. And this reduced functional connectivity might under a perceptual deficit associated with trait anxiety in these high anxiety individuals. So these are some of the networks, and I told you default mode networks is always having problems in the connectivity when there's a some impairment or some these psychological issues are there, when default mode network always gets affected. So what we have from this study, what we conclude, that the observed microstructural, neurochemical and functional changes in our study are similar to those obtained in various anxiety disorders. Actually, similar findings are also found in people who have actually anxiety disorders. So who are patients of anxiety. So, and these all patients are healthy individuals. So you can see if they are not treated for a longer time, these people can get into depression, and they will have further deterioration in their mental health. So anybody who has high anxiety all the times, it is better for one to take medical intervention or the preventive intervention and meeting a psychiatrist or a clinician to make some remedy for this. Then second part is, the depression. You all know people, depression is becoming very common, and according to World Health Organization, depression is the fourth most prevalent disease worldwide. And depression, people who are depressed have, they have anhedonia and feeling of sadness all the time. And it is shown that long-term exposure to multiple stressors has been suggested to play a role in the development of human depression. And we have this study is done on animals. This is done on rats. I will show you. And this we have used a chronic mild stress model of depression, which we have implemented on rats and shown how they behave, and how their the MRI studies can be carried out. So we have done the rat depression model was developed by imposing chronic mild stress. This is called CMS model of depression. And these stressors are those which mimic the environment of soldiers in warfield. Also, some of the people who have difficult job profiles, you can see similar, similar things are also happening with them. The model, after you made the model can be validated by performing behavioral experiments on the animals, like OFT, FST, and sucrose consumption test. These are some of the tests to see whether the model is working and the animal is in depression. Then subsequently, MRS acquisition and DTA was performed on these animals in hippocampal and prefrontal cortex. So this is the study which we did long back, and this is how you this is a CMS regime, and these are this is a 6 weeks regime where the animals were put in different situations, different stressful conditions for 6 weeks, and it is for 1 week. You can see there's a water drip aversion from day 1 to day 2. 12 hours there's no water given to these animals, and day 6 again 9 to morning, 9 to evening 6 o'clock, nothing, no water was given to them. They were deprived of water. Then you keep an empty bottle in front of them 9 to 11 hours, and overnight illumination, because rats need dark cycle, but if you get overnight illumination, this is also cause of stress for them. So you can see evening 5 to morning 10 o'clock they were put in illuminated environment. Similarly on day and 5, 6 also they were given. So these all are stressors. They are randomly given. They are not given periodically, because if you give them periodically, rat will understand that this is going to come next day at the same time. So they are all randomly put so that rats feel they are getting stressed about these things, and then food deprivation, restricted food access, then caged, soiled cage. All these stresses are given over a period of 6 weeks, and then after 6 weeks are over, then and in the meantime you keep on testing the rats. You give a sucrose water, and the rats which are healthy, they will consume lot of sucrose water. But as the rat goes into depression, the consumption of sucrose water will go on diminishing. So you can, after this is diminished, you can understand that the rat is going towards depression state. And then you can do a open field test, and you must have seen rats in your sometimes they come to your home. You'll always find healthy rats. They will always go in the periphery of the room. They will never spend much time in the center of the room. And you find a rat spending a lot of time in the center of the room, you must assume that rat is sick or he is depressed. That's a depressed rat or sick rat. So what we do in open field test, you there is a rat put in a maze, and this rat will go around. You monitor its movements, for a long time, climbing and then moving in the center, moving in the periphery. All these things are done to see and monitor. This is video camera. Video is taken for this rat, and then you measure all the times what rat is doing inside this maze. So I will stop this video. It's a very long video. So this is how you do these behavioral studies on rats. So then same way is force swim test. A rat is put in the jar of water. A healthy rat will always keep trying to save himself, keep floating in the and then climbing and jumping. And a depressed rat will give up after some time, like a human will give and is fully depressed. So this is another way of looking at whether the rats are in depression or they are healthy. So these are the two tests which was done on the rats to validate the model. And then we have this open field results of the open field test and the force swim test. You can see the overall activity of the CMS pre-CMS when they were not given any stress. This activity is much higher than the post-CMS where they are being given stresses and they are into depression. You can see all the activities are lower, and even climbing is lower. Grooming is also gone because now they are not well groomed. Center activities increase, as I said. They will spend more time in in the center of the room or the center of the maze, and then peripheral activities reduced. So same thing is in the force swim test, the immobility is increased in CMS rats, and swimming is reduced because they are swim for some time and then they give up, like a depressed person will do. Same way, climbing is also reduced in these CMS rats, the depressed rats. So after you see these, then you are ensuring that these rats are the model has worked and the rats are depressed. Then we subjected these rats to the NMR spectroscopy. This is a 7 Tesla animal MRI where this study was done, and they were done on the prefrontal cortex and hippocampus. Rats have very good spatial memory, and the hippocampus is the region which is responsible for that spatial memory. So we did prefrontal cortex and this hippocampal region. We took the spectrum, and then this is a spectrum from the rat brain, and we found very interesting results in these rats, and in the prefrontal cortex and also in hippocampus we found general decrease in all observed metabolites in depressed rats in prefrontal cortex. An elevated level of myocytol and taurine was observed only in the hippocampal area. Study showed a significant decrease in glutamate and glutamine level both in the hippocampus and prefrontal cortex in CMS rats. So we see this GLX level, which is a combination of glutamine and glutamate. Together, this peak is both the metabolites. You can see in depressed mat they are much reduced, and they are significantly reduced in the CMS rats, which are depressed compared to the healthy rats in prefrontal cortex as well as in hippocampus. And there are previous studies where people have shown that decrease in GLX levels have been observed to coincide with the transient experience of suicidal depression in patients receiving chemotherapy. This is a study where they have shown when the patients had lower glutamate levels, there was a tendency to do suicide. The suicidal tendency they had. So similarly, we also thought that we will take up now few more cases from the humans. We'll translate this study from animal model to human model and see people who had tried, this, who had to suicidal tendency. Do we also get the similar findings? This is a study which the group is, undertaking now. So very nicely it can show, and if you can find out in humans that there is a suicidal tendency and these metabolites are varying to that extent, then probably something can be done about them by increasing the glutamate levels so that they don't get so much that momentarily thought that we must commit suicide probably can be helped and they can be avoided. Similar way, we have seen the DTA study in the rat brain. You can see the prefrontal cortex, hypothalamus, and corpus callosum in all these areas. The fractional anisotropy is decreasing in the depressed rats. So that means the communication of the neurosignals will be diminished in these rats, and they have, and also we have found the MD values are increasing, which shows the inflammation process in the brain parenchyma of CMS model compared to healthy. So that means there is an inflammation in their brain because of this depression model. Then next topic is alcohol use disorders, and alcoholism is becoming very popular in around the globe, and a lot of people without they have alcohol on daily basis, and then they become addicted to alcohol. I'm not talking of people who take once, or they do a social drinking, but I'm talking of people who get addicted to alcohol. We call it now, as per the guidelines, we call them alcohol use disorder, not alcohol addicts. So we call this AUD subjects, and it has been shown uh, that chronic alcoholism is associated with many long-lasting consequences. One of which is impaired cognitive functioning, then attention, working memory, speed of processing, visual spatial abilities, executive function, impulsivity, learning, memory, and verbal fluency have all been shown to be impaired in alcoholics. And you have this technique MRI, which can give you a very global view of what's happening in these alcohol use disorder people who are who get addicted to alcohol. So we did, this is a study which we did. It's a very comprehensive study where we have tried to find out we have exploited all the parameters of functional parameters of the MRI to see this alcoholic problem in a very holistic way. So where we have done a functional MRI, task-based functional MRI in reasoning and language skills. Then we have done a box-based morphometry to look at the gray matter and white matter losses and the densities in the brain. And then diffusion tensor imaging to look at the microstructural changes in brain and looking at the FA and MD values, how these different areas get affected due to alcoholism. Then MR spectroscopy to look at the metabolic profiles in these patients, and also BVR Voxer based relaxometry where you measure the relaxation parameters in the areas where you have these area structures which get which are affected by use of alcohol. So we will go to these results one by one in the subsequent slides. So this is assessment of semantic judgment abilities in alcohol dependence, and we have found that and now board signal. Then we have shown that the regions which are critical to semantic processing is anterior lateral temporal lobe, and we have shown in alcoholics they show greater bold activation in right precuneus, left angular gyrus, left hippocampus, left middle cingulate gyrus, left middle temporal gyrus, and left postcentral gyrus as compared to the controls while performing a semantic judgment task. That means if there is a more activity in the brain, that means these alcoholics are they need more effort to perform a particular task because their brain is not functioning to that efficiency. So more and more neurons are firing to do that particular task. Similarly, they also showed, so that means the board signal increase is more in alcoholics compared to healthy people because you need more energy to perform a particular task. They are not able to utilize their energies in a very optimal way. Similar way, then the area of activation was more because there is a more neuronal firing in their brain to perform the task to the same accuracy levels as a healthy control was doing. So these are the areas where you have seen the cluster changes. The area of activation is more in alcoholics. You can see the results here. This is alcoholics minus control. You are comparing the two brains, alcoholic brain and the control brain, and these are the areas where alcoholics have there's an increase in activity. These are the voxels, number of voxels, where there's an increased activity in brain. And in similar way, this is the another task which is abstract reasoning, and we have done this, and we have found that again in abstract reasoning also alcoholics showed greater bold activation in right inferior temporal gyrus, right inferior frontal gyrus, right putamen, right superior parietal lobule. So all these areas there is a higher activation, greater bold activation in these areas in the brain in alcoholics compared to controls. So this is basically this great activation in the areas responsible for reasoning executive functions as compared to controls, which could account for their compensatory mechanism in order to maintain the same level of performance as controls, because they are able to perform the task to the same accuracy level, but they need much higher efforts. So that's why board signal and the region of area of activation is increasing in alcoholics compared to healthy control. So you can see how this is shown at the brain level, and then it is shown in the abstract reasoning task how the cluster is increased area of activation is shown in the different regions of the brain in alcoholics compared to healthy control. And then now this is these are the behavioral parameters. You can see here on the left hand side is the reaction time. You can see in alcoholics the reaction time is much higher than the healthy controls. You can see here controls, the reaction time is very less compared to alcoholics. So their reaction time is really badly affected, but accuracy is almost same in both, because they are able to do the task with the same accuracy, but their efforts are more. That's why reaction time is also more in alcoholics compared to healthy. So these are the different regions where you have measured these things, and then you can see board signal changes are more in alcohol dependence compared to these are these are the quantified values of the board signal in alcoholics and healthy control. You can see in all the areas, most of the areas, alcoholics are recruiting and having larger board signal compared to healthy. This shows there's a more need of oxygenation or the more need of energy to perform this task to the same accuracy as the healthy controls could do. So then we did the spectroscopy in these cases to look at the metabolic changes in frontal and occipital lobe, and we showed there's an increase in choline level, in a significant increase in choline levels, significant decrease in Na. Na is, I told you, it's a neuronal marker. If there's a degradation of neurons, the Na will go down, and then choline is membrane turnover. When their membrane gets affected, then you have high choline. You can see choline is increasing in alcoholics. Then glutamate is decreasing, and then -tol is also increasing in these alcoholics compared to healthy controls in both in the frontal lobe. These are the results in the frontal lobe, and this is, you can see the spectra from the control patient control volunteers, and these are the alcoholic use disorder individuals. So this is in occipital lobe now, in the visual area. Again, you can see all the areas which were, there's similar changes in different metabolites. The choline is increased, which is not a good thing. Any tumor or any degradation in the brain will have an increased choline and decrease Na. Then again the glutamate is decreased, and there's an increase in -tol. So there's a neuroinflammation taking place in the brain of these alcoholics, because of which the -tol is also increasing. And -tol, as I said, is always increase in dementia, Alzheimer's, or where you have any disorder of the brain, any psychiatric disorder. So here we are trying to show the how these metabolic ratios are showing correlation with these dysfunction scores. These are the dysfunction rating scores of the cognitive parameters. You can see when Na is decreasing, dysfunction is also increasing. So there's a positive correlation. Na is decreasing, this dysfunction score is also increasing. So this is a inverse correlation. Na decreasing, dysfunction score increases. This is a negative correlation between the two parameters, and you can see a positive correlation in the choline ratios. Because choline is increasing, that is brain is deteriorating, so dysfunction score is also increasing. So there is a positive correlation between the two parameters. And similarly with -tol and creatinine, we saw there's a correlation, very weak correlation between these dysfunction score and the -tol levels, but GLX level is again showing a negative correlation with the dysfunction score. So you can actually see which metabolites are responsible for a particular function. This function is Nehor-Benson test, which is basic for visual spatial skills. This test determines the visual-spatial skills in these alcohols. So that's why you are done the visual areas, visual cortex is spectra are taken. So what these metabolite means, neuronal damage or dysfunction in the metabolism is Na loss, because in these cases Na was decreased. Then cell damage due to alcohol-induced oxidative stress is likely to require increased repair of cell membranes and protein synthesis. This results in increased usage of glutamate. So glutamate is utilized. So there's a reduced levels of glutamate in these alcoholic patients. Minostrol is elevated in hyperosmolar states, and we see there's a neuroinflammation. So this minostrol is also increased. Then alcohol-induced hyperosmolarity may trigger accumulation of minostrol to stabilize the intracellular environment, and increase in minostrol may be a effect of proliferation or activation of glia cells. An increase in choline concentration could account for expression of glioses. So these are some of the explanations why these metabolites are changing or increasing or decreasing in alcoholic individuals. So this is a VBM study where we are trying to study the changes in the gray matter volume and the white matter volume. So these are the glass brain views in the gray matter changes, and lower one is the white matter changes. And which are the areas? There are loss in gray matter is in the observed in bilateral putamen. So there are several regions where you found a significant gray matter loss in alcoholics compared to healthy subjects. That means there's a gray matter loss that is also causing there's a structure function. Because of the gray matter loss, their function is diminished and they have difficulty in performing tasks which are shown by functional MRI. Same ways, the loss in white matter, you can see how these losses in different regions of the white matter are happening in alcoholic subjects. And interestingly, we found that no area of losses were observed in left hemisphere. Probably that is why the alcoholics don't have much of language problems. Their language fluency is intact. They can keep talking, whether they talk it absurd or the logical things, but they can talk very fluently during under the influence of alcohol also. This is a relaxometry where we are trying to measure the relaxation times in the alcoholism different. This is again a VBM type of thing, which will give you this change in relaxometric parameters in different regions of the brain. And we showed the changes in the T2 relaxation times in cerebellum, parahippocampal gyrus, right anterior cingulate cortex, left superior temporal gyrus, calcarine gyrus, and middle temporal gyrus with increased T2 values. And we also showed that when you compare this, correlate this with the dysfunction scores on your Benson test, they are showing a positive correlation with the T2 and the dysfunction score in the right cerebellum, and then calcarine gyrus. Here also you see a positive correlation, and you also see a positive correlation mediofrontal gyrus. So you can see all the four areas you are seeing a positive correlation with the VG test. And whenever there's a disease process sets in the brain, I told you the T2 resting time of the tissue changes, increases. So here also you're showing an increase in T2, and then dysfunction score is also increasing. That means the cognitive parameters are decreasing. The cognitive function is decreasing in these patients. So then this is a tractography of the diffusion tensor imaging, and you can see here also the FA values are significantly reduced in alcoholics compared to healthy. You can see this is corpus callosum in inferior fronto-occipital cortex, then superior longitudinal fasciculus, and then fornix, and all these regions you can see the FA values are reduced in the alcoholics compared to healthy controls. So all these now you have a multi-parametric approach to look at the brain of an alcoholic and how these cognitive functions or the imbalance, they can't balance their bodies when they are under the influence of alcohol, and all these can be studied using these techniques. So these are some of the publications on alcoholics. I think I will skip them. Then last part of the talk is on the neuroimaging. This is on the intervention part. That was the diagnostic part. Now it is the intervention part, and I am particularly focusing on meditation and yoga. I will show you some positive results of meditation and yoga in and the application of MRI in that. So we have seen that neuroimaging studies have shown that the regular practice of meditation bring positive changes in brain structure, function, and metabolism that improves the cognitive performance. We have always heard people talking about you do meditation, you do yoga, your brain will function better, your health will be, your physical and mental health will be better than people who don't perform. So here are some examples where we are trying to show that how MRI or fMRI can be useful in showing these changes in brain when a person is doing meditation. So this, I think this you already seen. This here I just want to say that by doing fMRI on different, you can find out the stages of meditation a person is in at a particular moment, because this is a process of training. You can see the activation pattern in the brain in initial meditators will be different than who are little experienced, and there are those who are highly experienced. The patterns are different. So this tells you, this can characterize the people as per their efficiency of doing the meditation as a task in these subjects. Then this is a DTA study, and we have shown people who are long-term meditators. We have shown that they are all these areas, the corpus callosum, which is the main area which connects the two hemispheres, is FA values are increasing in these meditators compared to healthy controls. And when you have a FA values are increasing by training of these processing of these signals, then all these people who do meditation, their reaction time, memory, all the cognitive parameters will be better off, because now you have a very good communication between left and right hemisphere, and the things can go very quickly. They can comprehend and give out the output whenever their decision making will become better. So there are a lot of benefits they will get by this method. And now this is where we show that the corpus callosum, all the parts of corpus callosum, and corpus callosum also has subsections which connect the different area in the brain. So all these areas which are important areas, splenium, isthmus, and then anterior body, then genu, the corpus callosum, all have increased FA values compared to healthy control. You can see in long-term meditators, it has increased, and MD is decreased, which is a very good thing for a healthy brain. So, and then there are some studies where they have shown that cortical thickness, the thickness of the cortex, it is believed the thicker the cortex, better will be your cognitive performance. And with aging, there's a diminishing of cortical thickness because of the neuronal degradation. So we have shown here, people have shown that people who made this, these are the correlation between age and the cortical thickness. People have shown that cortical thickness in people who are long-term meditators, it doesn't deteriorate fast. You can see this is a line which is showing the cortical thickness in meditators, whereas this is the line which is shown the non-meditators. You can see how cortical thickness is going down with age. But here they are more or less preserved. And we say if a person starts meditating from the age of 20-25, and his brain at 55 will also be like a non-meditator's 25 years old person's cortical thickness. So this is how you can preserve your cortical thickness in when you practice meditation. So, and cortical thickness helps you in performing your cognitive work, cognitive functions much better. Same as the cortical cortex in the prefrontal cortex. Here also you can see there's a diminishing of cortical thickness with age in non-meditators compared to the meditators. So these are these graphs show age and cortical thickness of each individual. These figures show that brain areas, the insula and the prefrontal cortex, that are thicker in practitioners of insight meditation than control subjects who do not meditate. So very good study, very good depiction of the results of meditation on brain. And this is again they have shown that by practice of meditation, this is a mindfulness based stress reduction technique. This is also a type of meditation. We have shown that there's an increase in concentration following 8 weeks of mindfulness meditation. You can see posterior cingulate cortex and cerebellum, temporoparietal junction, and cerebral and brainstem. These are the areas where they have seen increase in the gray matter concentrations. And here you can see the left hippocampus is much higher. The change in gray matter concentration in meditators compared to healthy control. So that means these people will have certain hippocampus gray matter is higher, so they will have much better memory and other learning capabilities compared to non-meditators. So this is a whole brain gray matter volumes. You can see here the gray matter volume is much higher in meditators compared to healthy controls. So, and there are different areas where you see, but this is a total intracranial gray matter volume shown in two categories: the meditators and non-meditators. So, and these areas are shown to be associated with sustained attention, cognitive control, emotion control, and feeling of compassion, suggesting that long-term practice may potentially enhance the functions meditated by these regions and result in neuroplastic enlargements. And if you keep working, keep doing meditation, so your area of in the brain, there's a neuroplasticity. By practice of meditation, you can increase these areas and have better cognitive performance in future. So this is a VBM study on Sahaj Yoga meditators. Here also the study has shown that long-term practice of the Sahaj Yoga meditation has statistically significant larger gray matter volume across the whole brain compared to non-meditators. Furthermore, gray matter volume differed in several predominantly right hemispheric regions in the insula, ventromedial, orbitofrontal cortex, inferior temporal, and parietal cortex. So this is how you can show these how you can show how this structure function relationship can be demonstrated by using different techniques of MRI. And this is one more study where they have shown in diabetics, people who do pranayam. In diabetics, they have shown that the N-acetyl aspartate, which is good for brain, is increased in people who do mindful. They do pranayams on a regular basis compared to diabetic patients who do not perform. And they have also seen the minocytol concentration is also reduced in people who do pranayam regularly. So this also shows that people with diabetes, they also tend to have they will also have cognitive decline because of these high sugar levels. So, but people who practice pranayam and breathing exercises, they can prevent this loss and preserve their brain for a longer duration. So very good study on this MRS. And then they also shown effect of yoga on oxidative stress in type 2 diabetes without complications. So they also shown that people who do regular yoga, their oxidative stress is much lower than the people who are off meditation. And this is they have also shown that people who perform Raj Yoga meditation, the diabetics, they have better glycemic control when they do Raj Yoga meditation compared to non-meditators. So these are some of the interesting studies which are in the literature, and many more are being done. And then also there are some studies on serotonin, these neurotransmitters, which cannot be seen in by MR spectroscopy in vivo, but by in vitro techniques, one can look at these neurotransmitters. And serotonin in urine has been found to be higher in meditators compared to non-meditators. Also, serotonin increases during TM compared to non-meditation. Serotonin plays an important role in mood regulation. So that means if you do this meditation, you will be always in good mood. You will be always elated mood, not in depressed mood. In transcendental meditation, in Siddha meditators, lower value of norepinephrine was observed in their blood samples compared to control subjects. and NE is involved in anxiety. So that means if there's a decrease in NE, that means they will be having less anxiety. These are some studies, very beautiful studies people have carried out on neurotransmitters and yoga. And the research has also shown that people with generalized social anxiety tended to have lower levels of dopamine compared to healthy controls. Another PET study observed an increase in dopamine levels in the ventral stratum of Nidra Yoga meditative practitioners, commonly associated with reward motivation and behaviors and social anxiety. So this also helps them in overcoming these social anxiety disorders. Melatonin in transcendental meditation, Siddhi meditators, it has been found that there's an increase in melatonin levels when they meditate during the night compared to night they did not meditate but just relaxed and other control. So unless they have found that they have a better sleep when they have this can be used in the treatment of sleep disorders. So very beautiful studies people have carried out using NMR and MRI. So there are some challenges when you do such studies, the meditation studies in MRI. First is, frequently because you are doing a task paradigm where you have to do a on-off, paradigm, then it's very difficult for people to switch on and off from meditation to non-meditation state. So, and that's why I feel it is better to do resting state fMRI and compare the two brains, people who are long-term meditators and who are not meditating, and compare their brains rather than doing task-based fMRI, which becomes very difficult because of these switching issues. Then posture limitation during imaging experiments. Most of the people who meditate, they do this in sitting posture, and when they are put in MRI, they are in the lying posture. So there's a limitation of posture because they are better in doing. They are always practice in sitting posture. So they are difficulty in doing these meditation practices when they are in lying posture. But the experts, they don't have problem. But the beginners and moderate who are moderately experienced, they have some difficulties in practicing meditation while they are in lying position. And then subjective assessment of these stages of meditation for the subject. Then when this person is meditating, we do not know what stage of meditation is performing and whether they is really performing any meditation or just lying down. So we don't have any method, subjective method. So that's why people have started doing, they are now doing the EEG and other parameters simultaneously with the fMRI. They measure the skin resistance and then body temperature and then the EEG. All these parameters are also measured while the person is meditating inside and you are doing functional MRI. And the research challenges in yoga research in future is to according to Patanjali sutras, yoga encompasses the following 8 aspects. So this is yamas, there's ethical guidance, then niyamas, the self-discipline, niyams or the you set your rules, then asanas, there's the physical posture, what you're doing, yoga, then pranayam, there's a breathing control, then pratyachara, hara is sensory withdrawal, and then dharana, the concentration, dhyana, the meditation, and the samadhi. These are the 8 stages of meditation, and it will be a great study if one can demarcate these 8 stages of meditation through imaging, through MRI or fMRI. So this is a great challenge when people are now trying to put there into at least from chanchalta to ekagrata to dharana, dhyana, and samadhi. These 5 stages one should be able to put forward using imaging techniques. And then one can also monitor physiological parameters like heart rate, respiratory rate, oxygen saturation, ECG, EEG, skin resistance simultaneously, so that you know to what extent the person has done meditation and what are the changes happening in physiology in addition to the in brain imaging in the neural correlates in the brain. So you will have all the parameters together simultaneously to arrive at a very authentic conclusion. So, and now the meditation and yoga, it is being practiced as a medical intervention in many of the hospitals now. It's like integrated, personalized approach, and a lot of people are now putting these therapies for interventions in neurobehavioral disorders. Of course, this was done before also, but now it's on increase. People are started because now once you show the benefits of meditation and yoga by scientific methods, people are getting more and more convinced. Then they really do help, and then this is being practiced on patients now. The neurological and endocrine disorders, anxiety and stress-related disorders is a area where this can really help a lot. People who are anxious and who are stressed, this technique, yoga and meditation can really help them to a great extent. Lifestyle problems, hypertension, diabetes, obesity, and cardiovascular disorders. Also, people are trying to treat these patients using yoga and meditation. Then post-traumatic stress disorder, traumatic brain injury, and ADHD. These are also areas where people are giving interventions. Then autism spectrum disorders and dyslexia, augmented cognitive capabilities in deficient efficient models. People are giving augmented reality, and people are training people. Suppose you have a attention in suppose you somebody is a fear, they will be brought into the virtual environment and shown some slowly, they will expose them to different scenarios where the fear component will go after some time when they are when they practice it again and again. And this is also being now used to enhance academic performance among children. This is coming into the school curriculums now. People are now enforcing children to do yoga and meditation, and they found that the academic performance, when people who do it seriously, it is improving in children. So I think this is how I wanted to cover today, and thank you very much for patient hearing.
Thank you, Professor Kushu. So participants, if you have any doubt, please ask him. And these are our last class. So any further doubt, you have to directly contact Professor Kushu. He has shared his email ID, so you can contact him directly.
And Professor Pal, I will send you a few articles today or tomorrow.
Okay. Yeah, sure, sir.
For their reading. For their reading.
Okay, sir has already shared some of the reading materials. He will be sharing some more. So go through this reading material, get ready for the exam scheduled on 12th October. Yeah. Yeah, naturally, they are the exam, right? Okay, sir. Thank you, Professor Kushu, for helping us in conducting this course fruitfully.
Thank you so much. And it was really pleasure.
In future also,
interacting.
Yeah, in future also I'll approach you to help us.
Yeah, but I will prefer to have this classes offline.
Yeah, that will be better. Yeah.
Yeah.
Next time actually we are discussing if you can arrange it in an offline mode.
I think this all 12 lectures can be covered in 3 days.
Right. That's what we are discussing. This is sir, actually we are discussing it. So next time we'll try to manage it in a physical mode.
Okay. Thank you so much.
Let us see how we can go about it.
And if you need anything from me, please let me know.
Yes, sure, sir. Well, I'll be disturbing you.
Yeah. Thank you so much.
Thank you, sir. Thank you very much. Okay. And send your study materials as.
Okay, I will do that.
Okay. And also take little trouble to send me that form.
I have sent the form, but unfortunately, I could not get the revenue stamp.
Okay.
I have signed there, but I went to 1 or 2 post office. It wasn't available.
Okay, if it's sent physically, no?
Sorry, I sent it by speed post.
Okay, let me get it. Then I will ask our account section if they can manage it.
Maybe.
Or they will find out some.
I don't know what is the cost of revenue stamp. I can send it, or maybe you can.
It is, but it's a government policy. Government trying to earn some.
No, it's okay.
That is the purpose. What else?
I went to 2 post offices near my home. I didn't get it.
I'll try to manage it with it. If any serious issue, then I have to trouble you again.
Thank you.
Okay, sir. And then.
Thank you so much.
And then setting up the question paper, you have to give some
Till what date you want these questions?
Huh? 12th is the exam. Even you take next week.
Okay, I will like to talk to you,
Yeah, sure.
one-on-one, to get some guidance about the
Yeah,
questions.
sure. So we will be in touch. We'll be in touch.
Okay, thank you.
Okay. Okay,
Thank you
sir.
so much.
Thank you very
Thank you
much.
so much. Thank
And
you.
keep in touch.
Yeah, sure.
Drop your mail and maybe we'll be in touch always.
Yeah, thank you so much.
Okay, sir. Thank you. Thanks,
Thank
sir.
you. Bye. Bye.